Infectious cause of liver damage or liver problem. Let's talk about infectious hepatitis. In terms of infectious hepatitis, we have hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis, let's ignore D, it's always with B. Hepatitis E virus, I'll discuss it in B. And let's include in here one more, Epstein-Barr virus and cytomegalovirus, which is the same family, cytomegalovirus. That's in terms of viruses, okay? Alright. Of course, the hepatitis virus are more likely. Okay, it doesn't mean anything else, other things cannot cause it. Okay, so we can include bacteria and parasites too, and worms, okay? Hepatitis A virus. At the end of the day, all of these hepatitis virus will cause hepatitis, which is acute inflammation of liver, or inflammation of liver. Very good. So if enzyme inflammation, that means what? At the end of the day, when tissue is inflamed, it will feel pain. So it will be right upper quadrant pain. That'll be for all of them. And if it's infection, what else would you expect?
Fever.
Fever, excellent. They will have jaundice. Very good. So look for those three things. That's for all of them. So let's not focus on that part of it. That's easy. And anytime you have hepatitis, you will expect fever, right upper quadrant pain, and jaundice. Always. Yeah. Hepatomegaly. The liver will swell. Okay. So let's include in here later on hepatomegaly. Okay, so there will be hepatomegaly. Now the right upper quadrant pain, there's tenderness as well. Okay. In hepatomegaly, you will feel the liver under your ribs, about a centimeter or so. So the liver will extend below your ribs. Okay, the lower ribs, blah blah blah. Okay, so that's the same for all of them. So we can really not differentiate based on symptoms. All of them will give the same issue. All of them will give you fever, right upper quadrant pain, jaundice, hepatomegaly, maybe nausea and vomiting. Okay, maybe vomiting blood in later, those things. It's all the same. The way to differentiate is, how do you identify the cause of each of them? Okay, so you have to focus on microbiology. Now, for now, we'll go not too much into details. Hepatitis A virus is an RNA virus. It's a single-stranded RNA virus. Hepatitis B is circular DNA, circular double-stranded DNA virus. Okay, double-stranded DNA virus. Hepatitis C is single-stranded RNA virus. Hepatitis E is single-stranded RNA virus. Okay. Epstein-Barr virus is double-stranded DNA virus. Cytomegalovirus, double-stranded DNA virus. But these are linear. I'll put L, linear. So immediately, if it's RNA virus, you will know which one it is. Out of the 6, 3 are RNA and 3 are DNA. But Hep B is double-stranded circular DNA. Whereas Epstein-Barr virus, cytomegalovirus is linear DNA virus. Double-stranded linear DNA virus. Okay. Further, hepatitis A virus is non-envelope. Has no envelope. Hepatitis E, non-envelope. Okay. B, enveloped. C, enveloped. Okay. Cytomegalovirus virus, enveloped. Oh my god. How do I spell envelope? I have no idea. Okay. There you go. That's how you'll differentiate. Now, okay. Hepatitis A virus only causes acute hepatitis. It only causes acute. Okay. Hepatitis E only causes acute hepatitis. Epstein-Barr virus, majority of the time acute hepatitis. Cytomegalovirus, most of the time only acute. Okay. Now, when it comes to hepatitis B, it causes acute first, You have to have acute first, right? Before it becomes chronic, and then chronic. Hep C, acute of course, and then chronic. Okay, there's the thing. Hep B, 80% of the time it is acute, and it's resolved. Look, if something is acute and never becomes chronic, that means what? It gets resolved. It's self-limited. So, hepatitis A virus is self-limited, right? You get an infection within a week, it's gone, like cold, like common cold, like sinusitis. Hepatitis E, within a week, it's gone. Maybe it gets prolonged 2 weeks, but it never becomes chronic. Now, hepatitis B, 20% of the time, it's chronic. So 20% of the cases becomes chronic. 80% will resolve. 80% will resolve. Let's go to C. In C, it's the opposite. 80% becomes chronic. Oh, I switched the location. So 80% will become chronic. So majority of hepatitis C infection becomes chronic. Only 20% will be acute. So hepatitis C is more chronic. It's known to cause chronic hepatitis. Good? Now, when it comes to B, think of B as babies. In babies, it's worse. So in newborns, in neonates, it is actually 80% that becomes chronic. So in neonate, 80% chronic. In adults, 20%. Okay? Why is that important? Because you will be asked about it. I don't know what else to tell you. Okay? Alright. Now, symptoms are the same. Everything is the same. Right? Which one is more likely to become chronic? C. 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 Done. C for chronic. C for chronic. C for chronic. And C for cancer. Yeah.
So,
yeah. Good.
hepatitis B, the more involved is the liver.
What do you mean?
In your book, I remember reading something in the liver. It's like more associated with the liver is hepatitis B over C, or overall.
No, they're both associated with liver. They're all associated with liver. I don't know. Read it again, maybe. I'm not understanding what you're saying yet.
So that 50% of the time, it's hepatitis B.
I have no idea. Yeah. Just read it again and let me know. Yeah. Oh. Okay. So now, how do you get it? How do you get these infections in the first place? Hepatitis A is fecal oral. Fecal oral. What does that mean?
By food and
Yeah, contaminated food. Contaminated food. And then how do you shed it? How do you introduce it to the environment?
eating.
Stool. Yeah. When I say shedding, you can just pronounce it a little bit slightly different. It will make more sense. So once the virus causes infection, then it's shed in stool. So fecal oral, that's what it means. Okay, so when you come in contact with stool and contaminated stuff. Now also water. You get it through water, especially fruit like vegetable, not like apples, strawberries, and stuff that you wash with contaminated water, which is common in third world countries. Okay, think of Asia. It's common where? Asia and Africa. A for Asia, A for Africa. Hepatitis A infection is more common where? In Asia and Africa. In the United States, it doesn't exist. It doesn't exist. Extremely rare. Okay.
They don't love the small things.
Yeah.
They love C, B.
Yeah. Big letters. Yeah. Now E is common in East Asia, which is Far East, China, Japan, Korea, those countries. Okay. Again, it's self-limited. It's acute. It's again fecal, oral. Okay, so you need to understand it. So maybe, how do you get it? By eating contaminated water or washed fruit and strawberries, apples, and things like that with contaminated water. Again, A is more common in Africa, E is common more in Asia, but that's say East Asia, meaning Far East. Okay, so.
If I'm adult, can better to have baby?
E, yes. B, yes. B, yes. E, not much. See, E gets worse in pregnancy. The only hepatitis virus the infection gets worse in pregnancy is E. E gets worse in pregnancy. And the only one that transmitted from mom to baby is B. It goes through placenta. Okay? So those things you need to understand. Write it down. E, infection with E, gets worse in pregnancy. So if a pregnant woman gets it, she will be worse off. So the symptoms and condition of Hep E infection are exacerbated, got worse, they get really, really bad in pregnancy. Okay?
Why is that? But will stay cured.
Huh?
Will stay as cured.
Yeah, it never becomes chronic. Yeah.
Why is that?
I don't know, honestly. Yeah, I don't. That I don't know why. Now, okay, so hepatitis B is STD. You also get it through blood. Okay? And hepatitis C, blood. It's more blood. It's more blood. Okay? C, more blood. So blood transfusion, sharing needles, sharing blood. But again, we have to be careful now. See, in the 70s and 80s, blood was not screened that much. So transfusion, so when you would take blood, you know, like those blood drives and stuff, blood was not screened. So if you have transfusion from 80s and 70s, yeah, people could have hepatitis C by that method. Today, blood is screened. So nobody should get it because of screening, because of transfusion. Otherwise, what would you do? You will sue the blood provider. Not the person, but who? The company who gives you, right? So blood transfusion, these days, blood is screened. So it's unlikely to get it from plasma or blood. Who would get it then? No, that's B. Drug abusers. Drug abusers. Drug abusers. People who share needles, cocaine, heroin, those people. Okay?
So where did it originally come from?
Originally, now. Again, it's found in an environment. Nothing unique, not animal, not mosquito, nothing like that. Yeah. Okay. Yeah.
Could it be from like non-sterile, for example, dental
Instruments?
instruments?
Of course.
Okay.
Yeah. Anything. Anything. But the issue is when it gets into your blood, it becomes more problematic.
Just because I know somebody who went overseas to do dental work.
Yeah.
And they ended up getting that.
Yeah, so again, it's blood because the instrument were stained or coated with blood and then they were reused. Yeah. So that's one thing. Also, in this country, prisoners will get it most. Why is that? It's a sad story though, but anyhow, you get the idea, I think.
Because they stab each other?
Not only stabbing, because of sexual abuse. Sexual abuse in prisons. Yeah. Okay? Especially in prison where there are men. And only men, and there is no women available, so they will, because of the anal intercourse. So again, in homosexual it's common too, or anal intercourse, because the tearing of the anal canal, which is smaller, you know, compared to birth canal, so it can lead to erosion and tearing, and blood will be introduced. Okay, so that's how you get it too. One more thing that's common in this country, you can get these infections, blood-borne infection. Tattooing. Needles, again. Yeah. So usually through tattooing. Well, they should. Yeah. But people are people. You get in hospital sometimes, right?
People are cheap.
Now we are at risk. All of you have to do Hep B vaccines before you go to clinicals. Why? Because you're at risk of what? Needle pricks. Yeah. Not necessarily stabbing, but the patient is agitated and you want to give them injection and they push you and the needle comes and you prick yourself. It's not always that you will intend to. Accidents, right? So,
Cheap for a needle.
yeah. So many things. Alright, are we good so far? So you should be able to identify them, which one causes chronic, acute, and what is the route of transmission. At the end of the day, remember, Hep B will become chronic hepatitis and will become then cirrhosis. And then will become hepatocellular carcinoma. Now Muhammad was saying something about that. It's also known as hepatoma. Hepatocellular carcinoma is also known as hepatoma. Okay. Hepatic adenoma is benign. Hepatoma is malignant. So make sure you differentiate between them. Hep C, same thing. It will lead to cirrhosis and then eventually to hepatocellular carcinoma. Now, who's more likely to go through cirrhosis and hepatocellular carcinoma? C. C for cirrhosis, C for cancer. Very good. C for chronic hepatitis. Okay. All right. Treatment. Or how about diagnosis? Hepatitis A, what would you do?
Nothing.
You can do PCR if you really wish to. PCR.
But hepatitis
Cirrhosis.
C is the only one that's really best for, right?
Huh?
Hepatitis C is the best one to do for PCR.
Yeah. So you can do PCR. You don't have to do for A. You're correct. For C, you have to do it. For A, you don't have to because it's self-limited. If you really have to, if you ask, PCR. PCR stands for polymerase chain reaction. This test is able to sense or identify or detect viral DNA or RNA.
It amplifies it, makes it easier to find.
So what it means, you have probes, you have RNA already stored that is exact complementary of this virus, and then you introduce that. If there's complementary pair found, that means in your blood. How did you get that? How did you get it? It must be from a virus. Now, since it's RNA virus, you will do a reverse transcriptase PCR, not for DNA. You will do it for RNA. Okay? Okay. For hepatitis B, what would you do? You can do PCR if you wish, but there's more tests. Let's do serology for this. Serology. And this is extensive. We have to spend time on it. Okay? Hep C, you will do PCR is the test of choice. Hepatitis E, you can do PCR, but you don't have to. Again, for these two, you don't have to do tests. Just treat them if you have to, or they're self-limited.
Self-limited.
E and A are both self-limited. Okay. So for hepatitis C, you must do PCR, and you're looking for viral RNA. You're looking for viral RNA, and essentially you will also do culture. If you do culture, you'll find envelope RNA virus, single-stranded envelope RNA virus, and that'll tell you that's the clue. Done. Confirming it. Now you can use interferon.
Doctor,
Yes.
hepatitis B, DNA, what the PCR is going to do now?
If it's what?
If it's DNA.
Yeah, so PCR, you can do PCR for DNA, and you can do PCR for RNA. You can do for both. But for RNA, it's known as reverse transcriptase PCR. Let me write it down for you.
Extra enzyme.
Reverse transcriptase PCR. Okay.
She's able before C.
So you do that, you have to make DNA first, and then make RNA out of it. Okay.
Make DNA out of RNA.
No, you make the DNA probe. So that DNA probe, and then you have to make the RNA out of that, and then you introduce it with complementary pairs. Yeah.
Oh, they don't amplify the DNA.
You don't have to. It's already amplified in your tissue. So PCR can be used for amplification if you want copies of DNA to store it or distribute it. In this case, you just want to sense, you want to detect, you want to find if there's RNA found in your plasma or in your blood.
So what's the difference between that and hybridization?
Hybridization meaning that you will combine two types of RNA and DNA. That's what hybridization is.
So reverse transcriptase for
RNA.
hepatitis C.
For all RNA, for any RNA virus, you will use reverse transcriptase. For DNA, you will just use simply DNA PCR. Okay, so you give interferon to both. Okay.
That's a medication.
Yeah, your body produces interferon, so now they're isolated. Interferon. Usually, your body should produce enough, but you can combine them with this with ribavirin. Okay, and now this combination should help
It's for hepatitis B.
for both. Okay, but again, not so effective. For B, it's more effective than C. C is difficult. Okay, new medication are existing too, but they're under trial. They're expensive and they have side effects too. So, yeah. But for the purpose of boards, that's what you need to know, not extra. Okay, there's multiple, especially in Europe. There's different medication, and then in Asia and Latin America, Australia has different medication. Canada has different. So we don't have to worry about them. For purpose of the board, that's good enough. Okay, you won't be tested on for any more than that. All right. So hepatitis E and A does not need treatment. Epstein-Barr virus is a DNA virus. Cytomegalo, they're the same family. They're both herpes family. Remember that Epstein-Barr virus and cytomegalovirus are both from the family of herpes virus family. They're a member of the same family. They're cousins. Okay. You can do a test for that. What test would you do? Yeah, you can do culture. Let's do culture. Viral culture, not bacterial, right? What else would you do? Zank smear. Okay. Now on this smear, so that means you have to do culture first and isolate the virus. You grow it. This will show you intra. Excellent. Nuclear.
Isn't that also mononucleosis?
Mononucleosis, yeah.
Is that the same as Epstein-Barr?
Intranuclear inclusion bodies. Now for Epstein-Barr virus, for cytomegalovirus, sometimes the term is used owl eyes, because the nuclei looks like eyes of an owl, round and big. Okay. You see, these are DNA viruses. Now, where is DNA replicated? In your cells. DNA replication, where does it take place? The nucleus. So this virus will assemble in the nucleus. So that's why you will see this virus particle where? In the nucleus. Okay? In the nucleus. So only DNA virus you will find intranuclear inclusion bodies. Inclusion means just small bodies, vesicles. Inclusion means what? Vesicles. These vesicles, these bubbles are full of what? Viruses. Okay, so these are virus particles. So you will see this in the nucleus. If it's cytoplasmic, it's not Epstein-Barr virus and cytomegalovirus. If cytoplasmic inclusion body, it's not them. It's RNA viruses, not DNA. Okay? Alright. Huh? For both. Yeah. All herpes family. The entire herpes family. They're all DNA viruses. They're all envelope DNA viruses. Double-stranded DNA envelope viruses. Okay? And please understand, what I told you about those. These are high-yield viruses, regardless. Especially the herpes family. Okay? Now, you could have hepatitis with Epstein-Barr virus. In addition to that, you will also have splenic enlargement. Splenomegaly. So that would be something unique. And you can have sore throat. Yeah. And this is known as mono or mononucleosis. Okay, a disease known as mono or mononucleosis. You have splenomegaly, sore throat, and muscle pain or malaise. Okay. You don't feel like getting up anything, fever, enlarged lymph nodes, and just severe fatigue. You don't feel like doing anything. And sore throat, especially the tonsil becomes enlarged. That's mononucleosis. It can lead to hepatitis. Now, Epstein-Barr virus rarely causes hepatitis. I just put it there just to tell you that, that other things can also cause hepatitis. Epstein-Barr virus, extremely rare when it comes to hepatitis. These are the most important one when it comes to hepatitis. These four. Okay? Now, cytomegalovirus will cause hepatitis in immunocompromised people, HIV positive, transplant patient. So cytomegalovirus is found in all of us. It does not cause infection in healthy people. It will only cause infection in who? Those who are weak immune system. Those who have a weak immune system. Either taking corticosteroids, either taking immunosuppressant drugs, or have leukemias, or taking transplant, things like that. All immunosuppressant can cause diabetics. Okay? So that's cytomegalovirus. The last thing when it comes to amoeba. Amoeba is a parasite. Okay? Amoeba is a parasite. It also causes hepatitis. Amoeba exists as a trophozoid, which is a swimming organism. Okay? Or it exists as a cyst. Okay? The cyst is unique. It will have 4 nuclei. It's like those coat buttons with 4 holes? That's the cyst for amoeba. This is the cyst form. Okay, the trophozoid is irregular shape. So amoeba is a parasite. It's a protozoa. Amoeba is what? Protozoa. Zoa means zoo, right? What kind of animals do you find in zoo? Those who walk, those who swim. Zoo means mobility. Zoology is the study of animals that move around, kind of thing. So these are motile organism. Protozoa is a single cell motile organism or parasite. Single cell. Protozoa is a single cell motile organism. Okay. So usually you'll get this from contaminated water. The source of this is usually water. Contaminated water. Contaminated water. Contaminated water. So again, it's fecal oral. Okay. So amoeba, once you ingest amoeba in your diet or food or water, whatever, first it will cause bloody diarrhea. And then the amoeba from your intestine will travel to liver. How would it travel to liver?
Portal vein.
Portal vein. Before that, superior mesenteric vein. Okay, then portal vein and then liver. In the liver, it will form cyst. So it will cause hepatic cyst or abscesses. And the abscess is very painful. Again, I will give it right upper quadrant, pain and tenderness, fever, and what else? It can give you jaundice, possibly, but not always. But hematemesis, which is vomiting blood. Vomiting blood. Okay. And then when you do CT scan, which is a good test to do, you will see hepatic cysts or abscesses. Okay, so look for that. And then you have to treat them with antibiotic. Metronidazole is the drug of choice.
You do all that now for there,
No.
that's only for T cruise.
Yeah. No, not only for T. cruzi. You can do it for those that will you find them in solution. Okay, so give them antibiotic, antiparasitic medication like metronidazole. Okay, you can use metronidazole to treat it. Clindamycin might work too.
Will this be in the blood or just all over or just go and migrate
In
to
liver.
certain area?
In liver. It stays in liver. It can go to other areas, but it's taken care of. Okay. Now you will also have, possibly in this case, you will have rash. And the rash is usually caused by IgE. All parasites cause rash to an extent. Okay. Alright. There you go. So these are the infectious diseases. There's some worms that can cause hepatitis too, but again, worms and parasites are not common in the United States. Where are they common? In third world countries. Asia, Latin America, and Africa, those areas. Okay? Okay. How long will we be going for? Let's take a quick break.